Hello and welcome, everyone. Thank you for joining us for our last podcast episode for 2024. And we thought it might be a topical point of discussion today, Bo, if we chat about the importance of reflection. It's that time of year where we'll often spend a bit of time thinking about the year that was and maybe planning and putting some goals and maybe some resolutions in place for the next year. And so I thought we'd chat about the importance of reflection, the things that make it effective, the pitfalls that you might fall into when the process isn't done maybe as effectively as it could, and basically how we can apply this to not just broader life-based goals and things, but also in clinical practice, getting better results for our patients. So let's have a chat.
Yeah, I mean it is really important, and it's something that should be done regularly. And it's you know yeah, around New Year's resolution times, everyone's reflecting and making or setting goals for 2025. Is that what we're up to?
Mm.
Um, and often they don't last very long, because it's really about looking at, well, what do I really want to achieve, and how do I make this achievable? Is this something that I can work towards? And setting up smaller goals along the way, and sometimes those goals don't actually work out, and so it's important to have those sub goals, and then reflect on and think, all right, well, what is it that I really want out of this, and what's not working, what can be modified, and how can I reset that goal? And so I think that's really important, because it can be a little bit disheartening if you set this big goal and you've got all of this motivation and you don't quite get there, and you go, oh well, it was too hard, I can't do it. So I think, yeah, really looking at reflecting on that process, because it really should be about the process and not just the outcome.
Definitely, I agree with that. And reflecting on the process is a good point. I think there's a phrase that always sticks in my head, which is relentless forward motion. And I think that's a nice way to kind of encapsulate the idea of setting goals and working towards them, because it's very easy, I think, to get trapped into this pattern of just doing. If I'm busy, if I'm taking action, if I'm just doing things all the time, I must be moving forward. Where you can be running in spot on you could be running on the spot on a treadmill and not be getting anywhere. You could be doing something, but it's not moving you forward physically or any kind of meaningful way. So the process of reflection, the process of thinking back over what the doing that you've done in the past has achieved for you, what have been the outcomes from those actions, and then thinking about what could you have done differently to achieve more outcomes, greater outcomes, moved you further along the trail in the process of all that doing, so that when you then plan for, prepare for, and implement the next phase of doing, you can get more out of that. And I think that doesn't happen unless you go through the process of reflection, not just of the activities that have taken place, but of yourself. Self-reflection is a really important thing. It's a difficult thing for us to do because our egos often get in the way of, like, I was busy. I was doing all these things. I must be productive. And I've been guilty of this myself. I've been very busy at different times, not an ounce of space to fit anything else in. And I look back and I think, well, I did a lot of things, but what did I actually achieve? And so until you can get through that process of real, honest self-reflection, which, like you said, should happen regularly and consistently, it's very easy to get stuck on that treadmill, that act of just doing for the sake of activity, without actually considering what's it getting for you in the long run.
Yeah, and it's difficult to do in the moment. And so it does require a little bit of planning, or allowing yourself some time to actually reflect and spend time, reflecting not only on personal things, professional, but then those goals for the future. And so obviously in the moment there is heightened emotional arousal. It makes it difficult for our prefrontal cortex, our higher cognitive processing, to actually make effective decisions and look at the objective measures by taking the emotion out of it. And so that's where just taking that time and using things like meditation and mindfulness to see if you can decrease some of that emotional arousal, and then you can actually reflect on what's going on, and why this certain thing happened. And it could be certain things that were preceding that behavior, or and then the consequences of that as well. And could any of those things be changed and learned from? Because that's really what reflection is about, is what was the situation, what happened, and what can be learned from this. And there could be, it could be from clinical practice, it could be engagement with that person, it could be that there was gaps in knowledge and you didn't know how to respond to that. And so then you look at that situation and go, okay, well, what are the things that were difficult or challenging in this situation, and how could I improve on that in the future? And that's how we'll progressively learn from that process, and you'll chip away at becoming a better clinician, improving your business, or improving all aspects of your life if you go through that process regularly.
Definitely. And the process is a tricky one for a lot of people. I think if you're like me and you've got ants in your pants and you can't sit still and not be doing something at all times, it can be very difficult to give yourself the bandwidth and the brain space to actually do some real honest and meaningful reflection. And I think, well, thinking about myself and how I manage that, if I want to have a think about something, if I want to reflect about something, I have to do it while I'm doing something. Because if you put me in a chair and say, just sit here and think about it, my mind will wander back onto different tasks. I'll walk the dog. So I'm moving, but I'm mindful of other things while I'm doing that. I'll be processing some thoughts. I'll be processing something that's happened and thinking about actions to take. And the reflection happens while I'm doing something. Some people like to meditate, like you mentioned. But for some people, that feels like cruel and unnecessary punishment. Whereas you can meditate while you run. I used to be into long distance running and I would do a lot of my best thinking, come up with my best ideas while I'm on a long run, letting my body do something else while my brain can kick into gear and focus on the thing, because then I'm not feeling like I'm wasting my time. And so for me, I walk the dog, go to the gym, on a long drive back and forth from the airport quite a lot, those sort of things. Those are the times where I'll spend a lot of time reflecting. And Bo, you'll know that's the time when all of the team gets all the messages and things from me, voice memos and bits and pieces. Is that, oh, Sean's on a long drive again, or he's walking the dog or something. And that's you've got to hack your own process. What is it that works for you? When can you create opportunities in your own mind, in your own kind of internal environment where you can let your brain go through those processes? And I think a lot of people will try to do it. Well, I'll spend some time thinking about when I'm in bed at night, but you're tired and you're ready to go to sleep. So you start the process and then you miss the end of it. So carve out some time. And if you're someone who can just sit on the front porch and stare up at the sky and think, then do it there. But you've got to understand your process and figure out how to do that effectively, because it's very easy to just, like I said before, focus on the doing and not just sort of stop and sit and think about it. And I think that's, yeah, it's such an important thing. And the longer I've gotten into my career, the more time I spend just thinking. And it sounds counterintuitive, like you should just get better at doing. But I think to get better at doing, you have to spend more time considering, reflecting, and thinking.
Yeah, and I see people that their lives are just so hectic. They say, "Oh, I've got no time for anything. I've got no time for exercise." Or, there's always things going on. It's okay. Well, there's probably something that's going wrong here, that you need to sit back and just stop for a minute and focus on, why am I so busy? What are some better ways that I could manage this? And so, if you're one of those people that think, I don't have time to exercise, what you'll probably find just by stopping for an hour, going for a long walk, that you'll actually feel more productive. You'll be more motivated. You'll have that time for yourself, where you can start to sort through these different processes. You'll actually be more creative. You'll start to come up with different ideas, and different perspectives. So it might sound like you're taking a chunk out of your day, but that chunk out of your day to spend time on yourself is one of the most important things. And that's where we can be so creative, as I said. And yeah, it's just about going through something that you enjoy. You can spend time breathing, thinking, whatever that may be, but you'll actually come back with a fresh perspective, and you'll probably start to find things that you can reflect on and say, oh, that's probably not working. So what else could I do? How could I change this? Is there a different approach that I could do here? So I think that's really, really valuable.
Yeah, for sure. And look, let's bring this back to the clinical setting or environment for a moment, then. zoom in a little bit, reflection in and around each patient consultation is such an important thing too. If we're trying to aim for best possible standards of care for our patients, and we do the doing with our patients, we assess them, we treat them, we go through that process, and then a lot of us will end up at the end of the day trying to remember all the things that we did and hurriedly writing the patient notes. And it doesn't really allow for a lot of time to process what's happened and the outcomes that we have achieved. And that self-reflection of the clinical application that we've been through with the patient, the assessment, the treatment planning, and the reassessment, and considering the potential for improved outcomes over time needs to be carved out in the day to do that properly as well. And maybe for some practitioners, it means setting aside, even if it's just 30 minutes a week, 45 minutes, an hour if you can, block out a patient appointment in the week if you can, and say, okay, I'm going to look back at patients that I've seen maybe one, two, or three or more times, and how are they progressing? What am I missing? Is there something that could get them further down the road than they are now if I was to implement that? And then the next time they come to see you, you don't just get better results, you get to blow them out of the water. You get to wow them with the impact that you've applied, because you could just do what you do each week and the patient could be satisfied and move forward and feel okay from each consultation. But what if each time they came in, you had something new, something different, an updated perspective to apply, because you've taken even 10 minutes to consider what else? In addition, what could I take out? What could I add in? What am I not considering? Who else could I ask about this? What other resources could I draw upon? What's happened in their past that maybe led them here rather than what have they just got today? So that zooming out on the patient and thinking about what you can bring back to them on the next consultation, that self-reflection process and that treatment reflection process can literally make you a 10 times better practitioner, I think, if you invest that into each consultation.
Yeah, I couldn't agree with that more. Often I review other clinicians' notes and students' notes, and often it's just what they've done. And I look at it and go, that doesn't really tell me much. It tells me what you've done, but what are you making of this situation? What is your clinical impression? Where are the gaps? What have you actually missed here in previous consultations? And where do they actually need to go? And so that is a process of reflection, because it's easy to just look at the assessment, look at the treatment, look at the exercise intervention. But what does that really mean? And often, even when I write my own notes, I'll think, you know what? I didn't look at that. And then so that goes in the notes to as something to look at for the next time. Your list of differentials, where could those exercises change or be modified, or what are some other factors that we need to consider? Because if it is just the same thing that you're doing and you're writing the same notes every single time, that's not reflection. That's just, banging your head against the wall if they're not getting any improvement. Okay. And so the note-taking process might be tedious for many people, but use it as an opportunity to actually get better from each consultation with a patient.
Yeah, definitely. And do that in the consultation. You're sitting with a patient and you say, okay, before we get started today, I've got some ideas and things that I'd like to implement into today's treatment. Before we do that, though, let's just reflect on how you felt since I've seen you last, or what have you been through? What's been happening? Because what you're presenting to me with today can obviously be a reflection of what's happened to you since I saw you last time. There's progression, things that happen over the time, and other inputs. So let's just think about this broadly for a second, and then the opportunity for the patient to kind of go, oh, actually, you know what? Yeah, I have been feeling better this week, but I've also slept better this week, and I haven't had as many drinks, and probably been eating better. And you think, oh, okay. So there's some other things to consider here. So it's maybe your pain, your headaches, whatever they're presenting with. There might be some other factors that aren't in your wheelhouse of normal consideration, but could be. You're like, okay, well, what can we do then to test this further over the next week? Can we implement some things so that you can see if this is the pattern, if these are the inputs that are going to make the bigger difference? Because I'm here to help you with what I've got, but unless we do some reflection and consider what else might be playing a part here, we might be missing, where the gold is in all of this. So reflection within the consultation with the patient, reflection on what you've done afterwards, outside of the consultation, looking back at what you've done, and also reflecting on, okay, if I was to be a better practitioner for this person the next time I see them, what could or should I do between now and that point in time? What could I read? What questions could I ask? Who could I go and see? What do I need to look up to be better? And if you do that, even for 5% of your patients, you will be 20 times better than you are now in a year's time. And so all of these little moments, these opportunities for reflection, I think really do have a cumulative effect over time.
Yeah, and imagine if we could even teach our patients to reflect a little bit more when we consider pain. And so patient will often say, "Oh, it's just sore. It always hurts." And so if we could say, "Oh, how were you feeling before the pain came on, or before you went to do a certain activity? Were there any other factors that might contribute to you having a heightened emotional arousal or heightened sensitivity?" And it could be things like, yeah, I've had a really stressful week. I haven't been sleeping well. And then, so what was the behavior that caused the pain? And then what was the consequence of that? Did they start to avoid movement and or avoid going into those situations? And so understanding that is important, because if they can go through that reflection process, then they can understand the situation a little bit more. They can understand these contributors and how to work towards better outcomes in the future. And so it could even be asking those questions from them. What is the situation? What am I most concerned about? And is this concern helpful for me at the moment? And so, if they're really concerned about making something worse, and is it helpful to not do any movement or any activity, it sort of gives them that opportunity to say, oh, actually, this is probably not that helpful. The most helpful thing would be to progressively work towards moving, or moving, doing some exercise. Are these fears and worries relevant at the moment? Okay, and so this really comes back to someone's previous experience and their expectation of pain. So this whole cognitive process of pain is very relevant to other factors in our life and how we can reflect on that. Because, if someone's had a previously poor experience, that, there's this expectation of pain, the body and the brain will be very protective and, try to help us to avoid that situation again. And so it's about rationalizing with our brain, is that the most appropriate response? And especially when we consider chronic pain situations, that response is probably overprotective and it's not appropriate to this situation. So we've got to gradually expose them to something that is more appropriate. And the process of reflection is really important in those situations.
Yeah, absolutely. That asking those questions, both externally and internally, is such an important thing for someone in pain, isn't it? Like you ask them questions about their experience. They get an opportunity to ask you questions about what it all means, and then you can clarify what the other person's experience is, and then they can clarify or get clarity around the potential long-term, short-term effects of this, and then everybody's more clear. I'm using the word clarity a lot here, but they get clearer. And when you are clearer, then your reflections also become more useful because you can reflect on a misinterpretation of something. You can reflect on something that you didn't quite understand or read the wrong way, and that just builds a feed forward process or a feedback loop that doesn't reinforce progress or doesn't reinforce a positive outcome. So those conversations you're talking about around pain are such an important thing to have, not just for the patient with themselves, but patient with you, and then you back to the patient, and that just creates this sort of little microcosm of greater understanding, and that really does create for a better opportunity for everybody going forward.
Yeah, and just it's an opportunity to challenge other people's beliefs, but when we do personal reflection, it's an opportunity for us to challenge our own beliefs. And I've said this in previous podcasts, that if you went into a clinical consultation, and at the end of that consultation, you needed to present your assessment, treatment findings to a panel of five people of your most experienced and most respected peers. And so, could you could you provide a really well rationalized argument about what you did and why you did it? And those peers would be aiming to poke holes in what you've done. And so being able to reflect on that yourself and think, well, what if it wasn't that condition? What else could it be? And then using that as a reflection, rather it's easy to get stuck in this bias to say, no, 100% it's a meniscus tear and there's no other option, so I'm going to treat it this way. Well, what if it's not? What if there was something else that was contributing to that? And would that change your treatment intervention? And how could you look at this from a different lens? So I think that's important, being open to those different things. And it's difficult when someone is working by themselves, where you may not have an opportunity to discuss case studies with others, and so you sort of have to pretend that you're working with other people. And what would they say? What questions would they ask? Why is that limited? Why is that painful? What are those other psychosocial contributors, and how are those being addressed? And then you get this broader view of what's going on, and that's all through the process of reflection.
Great suggestion. That consider yourself, put yourself in a scenario where three of your most peers would be looking at you, trying to get a greater degree of understanding about why you've made those decisions. And we've talked about the 5 whys in past articles and podcasts and things as well. And like it's a thing that's used in Japanese economics. But we ask the same question, why 5 times to somebody, and it really helps you drill down into the real meaning behind something. And so I did this application on a patient's ankle when they presented with pain, and you go, well, why? You go, well, I used it before and it's worked. Why? Oh, because I think the mechanism effect is this, and this is what I think it will achieve. Why? Oh, because the chronicity of the presentation. And the more times you ask that question, why, the closer you get to the real answer. And so picture those 2 or 3 or 4 or 5 panelists sitting in front of you. Great suggestion, Bo. And imagine each one of them saying why, over and over and over until you get so clear about why you've done what you've done and what else you could have done. That's a great opportunity for self-reflection. And you can just imagine all of that. You don't have to have someone physically do it for you. But it is, yeah, a great suggestion.
Yeah, and it allows you to find some of those holes in the argument, and then you take that information and go, okay, well, what do I need to do next? How do I learn from this experience? And how can I fill those gaps? And does that require additional mentoring? Does that require additional research, reading a textbook, asking more questions in the next consult? Uh, it allows you to identify these opportunities for growth and improvement.
Definitely. Let's zoom out again for a second and think about, imagine your life, or to everyone who's listening, imagine your life 5 years ago, where you were, what you were doing, what your day-to-day life looked like, what your future goals look like, and then flash forward to now. How different is that? And I think this is a really, again, a useful reflective exercise to do, because we often get stuck in this frustration at the end of, we come to an end of the year, like we're talking about this sort of process we go through at the end of the year often. We go, oh, another year's passed, that went so quick. I feel like I haven't moved forward, or, that goal of achieving this thing or doing that thing or being that person. I don't know that I'm that much closer to it. But go back 5 years. I guarantee anyone that does this exercise, you could do it three, so for some people it's 2 years, but go back 5 years and look at where you were, what you were doing, how you felt in yourself, the things you're striving for, and think about how different that is now. And now think about how many more blocks of 5 years you've got left in your career and in your life. How many more goes at 5 years do you get? I'm 45. Map that out. I've still got plenty. I've got heaps, right? And I think where I was when I was 40, 5 years ago, I go, oh, actually, I had a lot of goals. I had a lot of things. I had a lot of frustration too, because I wanted to be further along than I was. But if I went back to 35, at 40, I was doing pretty good. I was pretty satisfied with where I was. Now at 45, I feel like, wow, actually, yeah, I still feel a little frustrated. I still feel a little impatient at times about the things I want to achieve and create and do and build and so on. But go back 5, look where you were, Now flash forward five. Imagine that you've doubled that. Imagine you're that much further down the road and that much further towards your goal. That is a super empowering exercise to go through, and it really does help you focus on the positive because you can get very focused on the negative in all of this reflection. You go like, oh, I wanted to achieve A, I didn't. I got B and C, and they're nowhere near what A is worth to me. But maybe B and C in 5 years' time looks like 10 A's. So think about flashback, flash forward, and now extrapolate that to 10 years and 15, and think about how much more time you've got. That's a pretty exciting kind of model of thinking, I think. And it's just about perspective and just about reflecting on that perspective.
Yeah, I really like that. And, saying that success doesn't happen overnight, it's a process. And, some like especially new grads, they come out, I'll never understand all of this, or I'll never, get to where you are. It's like, well, these things again didn't happen overnight. And if you think about like if you just thought about it simply, if you want to improve your knowledge in one particular area, yeah, it's not going to happen straight away. But if you looked at that 5 year process, and what if you read one article per week over 5 years? How many articles do you have there? And so it's not that you have to cram everything in such a short time period. Just go through this process progressively, and you'll see changes over a long period of time. And then before you know it, you look back and go, yeah, wow, compared to where I was 5 years ago, I know quite a lot about this particular area.
Mm.
Um, and so yeah, it can be hard when you look at how far you need to go, but when you get to the top of that mountain, it's you look down and it's pretty rewarding.
Yeah, 100%. It's pretty easy to look outwards at others and go, wow, they weren't even on my radar. And now look at them. They're at the tippy top of their industry. That must have been like an overnight success for them. Yeah, it was a lot of nights in succession. There was years of overnight success that happened very, very slowly, progressively over a very, very long time. Nobody falls on the top of a mountain. You got to climb there. So, yeah, and that's that. I think coming back to that relentless forward motion is just about you'll progress faster if you use reflection. That's my point, right? If you reflect on what you've done and how you got there, and how you've done what you've done along the way, your progress builds. It's like a snowball rolling down, and it gets bigger and faster as it goes. The reflection is the momentum that you add to that thing, or you can be pushing a snowball up a hill, which is just doing and not thinking. It's like if I just pushed it, I'll eventually get there. There's more efficient and effective ways, but the reflection's the key point. The progress will happen. You got to keep doing the doing, but reflecting on the doing.
Yeah, but and also it's not about all the successes as well. Often you learn more from the failures. And so you might have had a rough 2024, but you'll probably have an even better 2025. So um, if you go through this process of reflection, don't just expect things to happen. But those failures are one of the most important things for growth because it does give you an opportunity to reflect on things that probably didn't go so well, and but then you've identified those gaps and how to improve from there.
Yeah, definitely. Look, that's such an important one, but we've been focusing on the goals and achievements and stuff, but people do have tough years. I from my biggest losses, I've been to zero a couple of times in my life, in my latter stage of my career in life, and those exercises of going through that process of going back to nothing or starting back to zero teaches you what you're capable of, right? You can lose it all and then go, oh, here I am, 5 years, 10 years, whatever it is down the track. I'm back where I was, or I'm further along. And if you've done that once, you can do it again. And if you've done it more than twice, there's the proof. There's the proof in the pudding. You can do that again and again and again if you need to. And imagine then the learnings that you take from those losses so that you don't have the same losses again. And then you extrapolate that on top of cumulative wins that you get from the learnings from the reflection. You don't just kind of progressively go up the hill. It's a ramp. You go up much faster over time. And so yeah, accept that there will be downturns, accept that there will be negative outcomes, that you won't win them all, and acknowledge the fact that the more you lose, I think everybody's got a certain number of losses that they're allocated in their life. This is just my internal theory. And if you can get them out of the way quicker and learn from them, then it's all gravy. Then it's all upside. It's if you just try to ignore the losses, ignore the hard times, and just focus on, oh, I got to always be moving forward and focusing on the wins. Then they just accumulate over time. Those negatives start to compound, and then your progress slows down. So yeah, use your reflection, focus on what you did well, do it again. Use your reflection, focus on what didn't go well. How can I avoid that? How can I step over that pitfall next time, rather than fall in it? And there's the recipe.
Yeah, and it's never too late to start. And so you might even look at if you are doing your New Year's resolutions and reflecting on, on the previous year and then goal setting for the next year, just know that your goal probably won't work out straight away. And so you've just got to not, I guess, not take that too hard. Say, all right, well, let's reset and refocus, and then go on that for the next month. So I think, yeah, rather than setting like a whole year goal, set monthly goals. You might have a larger goal, but set those sub goals, with monthly reviews, weekly reviews, however you choose to do it, and just write things down as well. I think, um, you know, after the situation that you want to reflect on, take some time, but then have an opportunity just to start to write those things down, and then even at the end of your year, you can reflect back on those things that you've written as well. So it just gives you a bit of an idea of, yeah, well, like I have progressed, even though I thought I didn't, but based on this objective measures that I've written down, then you can see a bit more progression that way.
Yeah, definitely. Oh, I reckon there's some good advice in there. Some good ideas, some practical things you can apply. Um, yeah, a quick reflection from our year of podcasting for everybody before we wrap it up. Like I know that the process of talking to you mostly most weeks and others who have had on the podcast throughout the year has been a great learning process for me too. It's an opportunity for me to clarify my own ideas and to build on them and add to them and maybe chip away some long held beliefs that weren't useful or weren't necessarily as correct or accurate as I once thought. And so conversations can be a great reflection exercise. They say, you only need one or two good friends in your life and just catch up with them regularly and you'll be a very fulfilled person. I think there's something in that. And so getting the opportunity to sit down with somebody that you respect and know well, have a conversation with them about anything, just verbally get out of your head what is in there, and you might be surprised what comes back at you to help you get more clarity. And the podcast has been a great opportunity for me to do that. I hope that it's been an opportunity for people to listen and do their own self-reflection as well, because that's really the goal of all of this. It's funnily enough, Bo, this podcast doesn't exist just for you and I to sit here and talk shop each week. But we hope that the people who have listened to it and taken something from it have been able to then use that information to do their own reflection and to make themselves better, more effective, more goal focused, more moving towards those goals over this last year.
Yeah, and I've got to say thank you to everyone that does listen, because I often don't think that people listen until we get to a course and, oh, I was listening to this and you said this and that. I was like, oh, did I that? Okay. Great. And then we can discuss that, but it's quite rewarding to see that people actually are listening and learning from it. So thank you for listening. I think that's great. I really appreciate it.
Yeah, definitely. We hope it's an investment in yourself. We try to make things interesting and entertaining, but it really should be about you. That's what this is all about. So thank you everyone for your time this year. Thank you, Bo, for everything you've put into the podcast this year and ACE more broadly. It's been a huge year for us here at ACE. We'll be doing our own reflection over the next few weeks before we get back into things in early January. We do our own very structured kind of reflection process and planning process each year, and that really helps to set us all up for our goals and the things that we're working towards. And we encourage you all to do the same. So, thanks everyone. Have a fantastic Christmas, New Year's, however you celebrate it, and we'll see you all next year.
Thank you.